because we don't live in a socialist society where everybody has the same thing, but we live in a society where, a capitalistic society where we have different strata of income, and based on your income is going to determine what your health is like. Doesn't that just make sense?
Yeah.
But we do have choices, and that's kind of what I want to focus on. So these are the things that I was asked to present on: the impact of diabetes in this region, how we can speak to families about obesity as a disease without body shaming. We've heard body shaming a lot, right? The number of physicians is low in this area, and how do we access care? And what can be done if we choose to become advocates in our community? So the impact of diabetes. Now, I've been in Charleston almost exactly 2 years. And Charleston is a place that has a specially refined taste buds. There's so many fabulous cooks in Charleston. There's so many fabulous restaurants in Charleston. And Charleston will not be good for your health if you hang out at them too long. But I want to talk to you about diabetes. And before I even get to these statistics, I would tell you this, that some data that I had a chance to review showed that between 2005 and 2016, that 51% of admissions to our health system had a diabetes component. They had a diabetes diagnosis. So what that meant is that over half of everybody that came to our hospital in that period of time came with diabetes as their principal concern. And I believe that that other 49% was one glass of sweet tea away from being diabetic too. I'm just saying. So these are statistics regarding South Carolina. 1 in 5 adults with less than a $15,000 annual household income has diabetes. Now, I put that piece of data first to show you that it's connected to economy. It's connected to how much money you make. How many people know it's very expensive to eat healthy? Have you ever tried to buy an organic cucumber? It is very expensive. Now, my mother, who is also a nurse, and my sister, who is also here, who's also a nurse and a health educator, it's a sickness that runs in our family. But my mother and I have been very focused on our food, and our family has been very focused on getting our weight under control and making healthier health choices. And on this side of 50, things move a lot slower, especially when you see the scale trying to move the negative way. It takes a lot longer, and that hormones has a lot to do with that. But I was trying to explain to my mother why organic costs more than inorganic. And she was like, okay, now listen, they have to put pesticides and germicides on all the food. So if they're putting all this extra on the food, why does it cost more than when they're not putting it on the food? And she said, it just doesn't make sense. And it's hard to convince Georgia Flowers, but that's a whole nother story. But the issue is that because mainstream, the mass marketing is toward the food that has all the pesticides and the germicides and the chemicals on it. To take it out means you have to take a different process, and that costs more. And that's why organic cucumbers cost $3 a piece. So it's expensive to try to eat healthy. So when you go to the doctor, and when you take your parents to the doctor, and they tell you, you've got to change your diet. But they don't tell you, you got to get at least $50,000 more in your bank account every year so that you can eat that way. But there are ways to mitigate that. And what I have found specifically in the South, where in Charleston we have 11 months of summer, I'm so surprised that we don't have more urban gardens.